Making medical decisions can be difficult. Being prepared is important, and making sure you have advanced planning can help. So advance directives are important. And joining me is Carol Waldemayer, who's patient advocate with Hardin Memorial Health. Thank you for being here, Carol.
Thank you, Karen.
Tell us a little bit about the umbrella of what advanced care directives actually mean.
All right, I'd be glad to. In Kentucky, we do have the advance directives, and we have the legal documents of a living will or a power of attorney for healthcare decisions, and also the ability for healthcare surrogates to be appointed, which could also be referred to as healthcare proxy.
So when we hear the term living will, what does that entitle?
Okay. The living will is a legal document, and it does include several things that a patient can consider doing as far as appointing a healthcare surrogate. This can be one or more individuals. It also looks at the end-of-life wishes and how they would like to direct their family and their physician. At that point, if it's been determined by two physicians, which is required with our Kentucky law, that they are either permanently unconscious or in an irreversible situation and unable to recover, then we would look to what their directions are only at that point. And I think that's very key. A lot of times people think they are completing a living will and we're going to look to it immediately. We only look to it at that point when they have lost decisional capacity and it is determined by two doctors that they are permanently unconscious or in a terminal condition they're unable to recover from.
So it appears an advanced care directive is not necessarily one document, but several pieces of documents and decisions that have been made to help during those times.
Exactly. Again, we're trying to give the power back to that individual to make their decisions known and to put their wishes, to perpetuate them out into the future, if you'll think about that. Or you're making them in advance, but you're putting those wishes out there so that your physician and your family can follow those wishes and honor your wishes and have certainty that they are following your wishes.
What is the difference between a power of attorney and a healthcare surrogate?
All right. Actually, they're very similar, if you will think of that. The healthcare surrogate, which can be named in the living will, is someone who is making your healthcare decisions. But again, we are only looking to that individual. Say if you are temporarily unconscious and unable to make your own healthcare decisions, then we would look to your healthcare surrogate or healthcare power of attorney. It is also looked at when someone is permanently unconscious. And at that point, the healthcare surrogate has an important role to honor that individual's wishes. So they have said in advance what they would want their wishes to be.
Understand. Now, when we talk about the power of attorney, what does that actually mean?
Again, the power of attorney it can be for healthcare decisions or financial decisions. Sometimes that will be combined in the same document, sometimes separate. But what we are concerned with at the hospital is, of course, the medical decisions and healthcare piece of that. So we would look to that individual when who they've named to be a healthcare power of attorney if they are disabled or incapacitated.
So in coming to the hospital or maybe having some medical procedures take place, what should an individual bring with them in preparing for those situations?
Well, it's always excellent if we can have that living will on file. If they have not completed one, we are happy to assist in doing that. Our patient advocates are notaries, and we'd be happy to discuss that with the patient and then complete that and notarize the living will so that can become part of their permanent medical record.
Do those need to be updated on a regular basis?
They remain in effect, so they do not expire. So at any time, if an individual wants to update, say name a new healthcare surrogate, or maybe they've changed wishes about organ and tissue donation, anything that they would like to update, we would look to that most current date and do a new living will.
Carolyn, discussing the living will, where can you obtain that document and how do you get that started?
All right. At the hospital, we provide that living will free of charge. We're glad to go over that with you and discuss it and notarize the patient's signature on the document. So that is available at the hospital with the patient advocates and throughout the hospital.
Does an attorney need to be involved in this process?
Not specifically for the living will. I mean, definitely you can always seek legal counsel, but this is a pretty explanatory form that we can discuss with patients.
Now, this is a state document, is that correct?
It is correct. It is a legal state document.
Is it free, or is there a charge in actually?
It is free at the hospital. We do not charge for discussing that with the patient or notarizing their signature.
All right.
And completing that.
Well, for more information, this has been Health in the Heartland. You can go to www.hmh.net and start this important conversation with your loved ones and your family members.